infectology. The first topic is referring to infectious diseases, what they are, and the course of infection and characteristics. What is an infectious disease? It's an illness that is caused by a pathogen or its direct toxic product that is acquired by a susceptible host. The development of this kind of illness is related to multiple factors, which are explained by the epidemiologic triad. That's the model that explains the development of illness. And it says that a combination of factors related to three categories actually determine the development and the manifestation of said illness. The first is the pathogen, next is the host, and the third is the environment. I will expand now on the infectious agent, or what I said, the pathogen. The infectious agent is a cellular. An infectious agent is an infectious agent could be cellular, acellular, or even just a prion, not even an organism, because it could be a prion, but that is able to invade a host or cause disease. Factors that affect the development of disease or that enable it to develop disease include infectivity, which is the likelihood of infection following exposure, which means once you have been associated, have been introduced to this factor through whatever, the ability of the factor to enter your body and to replicate there. Next is the pathogenicity, which is the ability of it to cause disease or manifestation once infection has already occurred. Next is invasiveness, which is its ability to penetrate tissue and spread. And next is virulence, which is its ability to cause a clinical manifestation, and that is determined by some structural or biochemical properties of the pathogen. And what else? It can have toxicity, which can cause a poisonous reaction, or antigenicity, which is its ability to stimulate an immune response. Host factors develop the vulnerability, not the vulnerability, but the susceptibility of the host to infection. And it is influenced by a lot of factors, including the host's age, underlying diseases, immune status, stress, nutritional status, and, for example, pregnancy, which at certain stages functionally decreases immunity. We'll talk about that later. Next, we have the environmental and mental factors. No, just the environmental factors. And they determine the host's vulnerability to disease. They include the climate and the weather. For example, the fungus Malassezia fulfu thrives in hot and humid climates. Natural disasters, for example, earthquakes, can increase the transmission, a lot of sand in the air, and can increase the coccidiomycosis. Infrastructure, for example, defective plumbing can cause more severe acute respiratory syndrome. War and conflict could cause crowding, which then increases the likelihood of scabies, and social or behavioral, for example, taking part in high-risk sexual activity or recreational IV drug usage, not suggested. Next, we have periods of infection or stages of infection. So how does it develop? Most infections or all infections are characterized by these periods. The first one is the incubation. The incubation occurs after entry of the pathogen while it is multiplying, but no symptoms occur yet. The duration varies, of course, of every factor of these based on the pathogen. Next is the prodrome. The pathogen continues to replicate. An immune response starts to occur, but there are no specific symptoms yet. The patient usually is contagious in this stage. Next is the actual illness, which is characterized by specific symptoms, full clinical signs and symptoms. Typically, the disease is most severe and contagious in this time, and that's about it. Next is the decline. Symptoms gradually diminish, and this is when the host is actually the most susceptible to secondary infection. Next is convalescence or recovery. Patient gradually heals and tissue repairs, and it can have residual or no symptoms. Generally, this is the normal development, but there can be complications such as latent infection that can be reactivated. Relapsing infection, same thing, reinfection, can especially occur, for example, with Borrelia recurrentis because of antigenic variability, so you can't really create an immune response, or co-infection, superinfection. Next, we have the classification of infectious diseases, and they can be according to a lot of categories. The first is duration, acute, rapid onset and duration. Subacute develops slower but is still fast. Chronic, slower development of symptoms, and they persist over a long duration. And latent, it is a period in which the pathogen remains dormant but can reactivate at any time. Kind of scary, huh? The location, it can be local, confined to a specific area or organ, or it can be systemic, where it spreads through the body and affects multiple organ systems. Due to its cause, it can be primary, which means it occurs in a previously healthy person, or secondary, which occurs in a person with underlying infection. Its source can be endogenous. It exists in the human itself. Can be exogenous, originates somewhere other than the human body. Opportunistic, usually causes a mild infection in immunocompetent people, but in immunosuppressed people, it has severe manifestations. For example, Cryptococcus, which causes severe diarrhea in HIV patients, but generally is absolutely fine in immunocompetent people, and also a zoonosis, which comes from animals. Setting of acquisition. It can be community acquired outside of a healthcare setting, nosocomial or iatrogenic. That's all. See you.